Well, there could be a few different causes, but probably the most common cause is something called dynamic nasal valve collapse. And that's something that when a patient takes a deep breath in, their nostrils actually collapse in under the force of the air that's trying to rush through their nostrils. A lot of doctors that are really trained to look for it will pick it up, but a lot of doctors, maybe more general doctors, might not look for that. And so that's something that we tend to look for when we see our patients here. No, certainly allergies and other causes of congestion, such as chronic sinusitis, are common causes for these symptoms, but you can also have these symptoms if your cartilages of your nostril are not strong enough to withstand the force of the air going through. Really, it's just feeling like your nose is blocked, and it tends to get worse when you're breathing harder. So during, physical activity or even at nighttime during sleep. So fortunately, there's a number of treatments that are possible. Some are very easy to use and inexpensive, and they can be purchased at the pharmacy. These include things like nasal strips that can be taped onto the nose, and they can hold the nostrils open during exercise or at night. There's even nasal cones that can be used and reused, and they have to be placed in the nostril. But a lot of patients don't like using these things because it can irritate the skin or it can just feel uncomfortable. So there is a procedure that we offer here, which is called a lateral nasal alar implant. And this is an implant that can be inserted in the clinic under local anesthesia with minimal discomfort and will provide lasting resistance that will improve symptoms of dynamic nasal valve collapse. In general, no. Unlike a cosmetic procedure, this is not designed to change the appearance of the nose. However, sometimes patients can feel a little something in the nostril for a period after the procedure, but this tends to go away with time as the implant eventually dissolves and is replaced by scar tissue. So we freeze the nose in several steps. First with a cotton ball using a topical anesthetic. Then we use a local anesthetic with a very fine needle like your dentist would use. And then we use the applicator for the implant, which is like a large needle. And we're able to then release the implant in position under the skin of the nose. In general, no. The only part that patients tend to feel is really when we're freezing the nose. After that, it's really quite painless. In fact, there's very few side effects, and patients are able to recover quite quickly and go back to work the next day. Really, it would be anybody with symptoms of nasal obstruction who've tried the simpler methods, such as the nasal strips or the nasal cones, and who've had a good result from those and would like something to be done that's more permanent.